Welcome to our medical surgical quiz, where we put your nursing knowledge to the test. In today's video, we're covering critical topics like patient care, legal issues, and essential interventions in medical surgical nursing. Whether you're prepping for exams or sharpening your clinical skills, this quiz will help you build confidence and tackle the challenges you'll face on the floor. Let's see how much you know. Let's get started. 1. A nurse is caring for a client with pneumonia. Which of the following is the priority nursing intervention? A. Encourage fluid intake. B. Administer antibiotics. C. Teach deep breathing exercises. D. Provide oral care. Answer: B. Administer antibiotics. Rationale: antibiotics are the priority in treating bacterial pneumonia to prevent further infection, while encouraging fluids and teaching breathing exercises are important. Resolving the infection takes precedence. 2. A client with chronic kidney disease has a potassium level of 6.0 milliequivalent/L. Which intervention should the nurse anticipate? A. Administer furosemide Lasix. B. Provide a potassium-rich diet. C. Administer sodium bicarbonate. D. Administer spironolactone, aldactone. Answer: A. Administer furosemide Lasix. Rationale: furosemide is a loop diuretic that helps to lower potassium levels. A potassium level of 6.0 milliequivalent/L is high and must be treated to prevent cardiac complications. 3. Which assessment finding would be most concerning in a client with heart failure? A 2+ pitting edema in the ankles. B. Productive cough with pink frothy sputum. C. Heart rate of 88 BPM. D. Fatigue after activity. Answer: B. Productive cough with pink frothy sputum. Rationale: pink frothy sputum is a sign of pulmonary edema, which is a medical emergency in clients with heart failure and requires immediate attention. 4. A nurse is assessing a client with cirrhosis who reports frequent nosebleeds. The nurse should check which laboratory value? A. Potassium. B. Platelet count. C. Albumin. D. Ammonia. Answer: B. Platelet count. Rationale: clients with cirrhosis often have thrombocytopenia due to liver dysfunction, which can lead to bleeding problems such as frequent nosebleeds. 5. A client with peptic ulcer disease reports black, tarry stools. What should the nurse suspect? A. Hemorrhage. B. Constipation. C. Iron supplements. D. Malnutrition. Answer: A. Hemorrhage. Rationale: black, tarry stools, melena, suggest gastrointestinal bleeding, which can occur with peptic ulcer disease. 6. A nurse is caring for a client with a small bowel obstruction. Which finding requires immediate intervention? A. Abdominal distension. B. Absence of bowel sounds. C. Vomiting. D. Fever of 102 degrees Fahrenheit 38.9 degrees Celsius. Answer: D. Fever of 102 degrees Fahrenheit 38.9 degrees Celsius. Rationale: a fever in the presence of a bowel obstruction could indicate bowel perforation or infection, both of which require urgent medical intervention. 7. A client has undergone a total hip replacement. Which intervention should the nurse include in the care plan to prevent dislocation of the prosthesis? Place pillows between the legs. B. Keep the client in a low Fowler's position. C. Encourage hip flexion greater than 90 degrees. D. Assist the client in crossing the legs. Answer: place pillows between the legs. Rationale: placing a pillow or abduction device between the legs helps to prevent dislocation by keeping the legs properly aligned. 8. A client with COPD is receiving oxygen at 4 liters per minute via nasal cannula. Which of the following should the nurse monitor for? A. Respiratory depression. B. Hyperventilation. C. Tachypnea. D. Cyanosis. Answer: A. Respiratory depression. Rationale: In clients with COPD, high oxygen concentrations can suppress the drive to breathe, leading to respiratory depression. 9. A nurse is caring for a client who has undergone a thyroidectomy. The client reports tingling in the fingers and around the mouth. What should the nurse assess next? A. Sodium levels. B. Calcium levels. C. Thyroid hormone levels. D. Potassium levels. Answer: B. Calcium levels. Rationale: tingling in the extremities and around the mouth is a sign of hypocalcemia, which can occur after thyroid surgery due to inadvertent removal or damage to the parathyroid glands. 10. Which intervention is most important for a client with acute pancreatitis? A. Monitor blood glucose levels. B. Encourage fluid intake. C. Provide a high-protein diet. D. Administer antacids. Answer: monitor blood glucose levels. Rationale: pancreatitis can affect the pancreas' ability to regulate blood sugar, making blood glucose monitoring essential. 11. A client with a new ileostomy reports liquid stool and frequent output. Which nursing response is appropriate? A. This is normal for an ileostomy. B. You should avoid eating high-fiber foods. C. Increase your fluid intake to avoid dehydration. D. We may need to reduce your dietary fat intake. Answer: this is normal for an ileostomy. Rationale: an ileostomy typically produces liquid stool because the colon, which absorbs water, has been bypassed. 12. A nurse is providing care for a client with liver cirrhosis. Which findings suggest the client has developed hepatic encephalopathy? A. Weight gain. B. Jaundice. C. Asterixis. D. Ascites. Answer: C. Asterixis. Rationale: asterixis, also known as liver flap, is a classic sign of hepatic encephalopathy, a condition caused by the buildup of toxins in the brain due to liver failure. 13. A client with type 2 diabetes mellitus is prescribed metformin. Which laboratory value should the nurse monitor closely? A. Creatinine. B. Potassium. C. Calcium. D. Platelet count. Answer: A. Creatinine. Rationale: metformin is contraindicated in clients with renal impairment because it can lead to lactic acidosis. Monitoring creatinine helps assess kidney function. 14. A nurse is caring for a client after a myocardial infarction. Which assessment finding is most concerning? A. Blood pressure of 140/90 mmHg. B. Heart rate of 110 bpm. C. Chest pain radiating to the left arm. D. Third heart sound, S3. Answer: D. Third heart sound, S3. Rationale: the presence of an S3 sound may indicate heart failure, which is a complication following a myocardial infarction and requires prompt intervention. 15. Which of the following is a priority nursing diagnosis for a client with Guillain-Barré syndrome? A. Risk for infection. B. Impaired skin integrity. C. Risk for aspiration. D. Deficient fluid volume. Answer: C. Risk for aspiration. Rationale: Guillain-Barré syndrome can lead to weakness of the respiratory muscles and dysphagia, increasing the risk of aspiration and respiratory failure. 16. A nurse is caring for a client with deep vein thrombosis, DVT. Which intervention should the nurse implement? A. Massage the affected leg. B. Encourage walking and exercise. C. Apply sequential compression devices. D. Administer anticoagulants as prescribed. Answer: D. Administer anticoagulants as prescribed. Rationale: anticoagulants are the primary treatment for DVT to prevent further clot formation. Massage and exercise could dislodge the clot, causing an embolism. 17. A client with Addison's disease is admitted to the hospital. Which finding is most important to report to the healthcare provider? A. Blood glucose of 65 milligrams per deciliter. B. Blood pressure of 88/60 millimeter of mercury. C. Sodium level of 138 milliequivalent/L. D. Potassium level of 3.6 milliequivalent/L. Answer: B. Blood pressure of 88/60 millimeter of mercury. Rationale: clients with Addison's disease are at risk for adrenal crisis, which can cause hypotension. Low blood pressure needs immediate intervention to prevent shock. 18. A nurse is teaching a client with hypertension about diet modifications. Which food should the client be advised to avoid? A. Bananas. B. Grilled chicken. C. Pickles. D. Oatmeal. Answer: C. Pickles. Rationale: pickles are high in sodium, which can worsen hypertension. Clients with high blood pressure should limit their sodium intake. 19. A client with a history of GERD is at risk for which complication? A. Peptic ulcer disease. B. Barrett's esophagus. C. Diverticulosis. D. Crohn's disease. Answer: B. Barrett's esophagus. Rationale: chronic gastroesophageal reflux disease (GERD) can lead to Barrett's esophagus, a precancerous condition involving changes in the esophageal lining. 20. A nurse is caring for a client with acute pancreatitis. Which laboratory result should the nurse expect to be elevated? A. Amylase. B. Hemoglobin. C. Calcium. D. White blood cells. Answer: A. Amylase. Rationale: elevated amylase and lipase levels are indicative of acute pancreatitis. 21. A client with hyperthyroidism is being treated with propylthiouracil, PTU. Which symptom indicates a serious side effect of this medication? A. Increased appetite. B. Sore throat. C. Weight loss. D. Tachycardia. Answer: B. Sore throat. Rationale: a sore throat may indicate agranulocytosis, a dangerous side effect of PTU, which results in low white blood cell counts and increased susceptibility to infection. 22. Which of the following assessments is most concerning in a client with a new colostomy? A. Pink, moist stoma. B. Stoma protruding from the abdomen. C. Dusky, blue stoma. D. Mild swelling around the stoma. Answer: C. Dusky, blue stoma. Rationale: a dusky or blue stoma suggests compromised blood flow and tissue ischemia, requiring immediate attention to prevent necrosis. 23. A client with Cushing's syndrome is being discharged. Which instruction is most important for the nurse to include? A. Avoid foods high in potassium. B. Monitor your blood glucose regularly. C. Limit your fluid intake. D. Increase your sodium intake. Answer: B. Monitor your blood glucose regularly. Rationale: clients with Cushing's syndrome are at risk for hyperglycemia due to increased cortisol levels, so monitoring blood glucose is important. 24. Which nursing intervention is most appropriate for a client with myasthenia gravis who is experiencing difficulty swallowing? A. Offer thin liquids. B. Encourage rest before meals. C. Position the client supine during meals. D. Administer anticholinergics before meals. Answer: B. Encourage rest before meals. Rationale: rest helps conserve energy and improves muscle strength in clients with myasthenia gravis, reducing the risk of aspiration during meals. 25. A client with a history of alcohol abuse is admitted with signs of liver failure. Which of the following should the nurse expect? A. Hyperactive reflexes. B. Decreased ammonia levels. C. Elevated bilirubin levels. D. Increased appetite. Answer: C. Elevated bilirubin levels. Rationale: liver failure can cause a buildup of bilirubin in the blood, leading to jaundice and other symptoms. 26. A nurse is caring for a client with a new tracheostomy. What is the priority intervention to prevent complications? A. Suction the tracheostomy every hour. B. Ensure humidified air is provided. C. Change the tracheostomy ties daily. D. Perform tracheostomy care every 4 hours. Answer. B. Ensure humidified air is provided. Rationale. Humidified air is essential to prevent drying of secretions and mucus plugs, which can obstruct the airway. How many did you score? Let me know in the comment section. Don't forget to like, share, and subscribe. I hope to see you in the next video.